even on the Nimbus side, as we're building these protocols out, right? We rolled out men before women.
Yeah.
And that is by design, because here's the reality with women's hormones. It is not just one thing you're trying to treat and work on, right? It is a constant effort of balancing because so many things change throughout even the weeks that affect hormones. And now you're not just dealing with just testosterone you're looking at, or cortisol and testosterone. Yeah. You're looking at estrogen, progesterone, testosterone, cortisol, right? And the symphony needs to be managed by somebody.
It does.
Really well to get the maximum outcomes, right? And if you don't do it, that is the problem. If you don't actually manage the symphony well, guess what? You got an angry woman on your hands.
Yes, you do. And then they offer them an antidepressant.
Yes. So it is some work to balance it out, because somebody needs to be subject matter experts like you who understand it, to go in there and be like, you know what? You are in this time of stress in your life, right? That stress is pulling from your cortisol.
Absolutely.
And that's throwing this thing off and this thing off. Let's do this, right?
Right.
One, we know medical professionals don't get enough training on this. Nope. So there's such a big disconnect, right? Yeah. To be the, what are they called? The symphony masters at the orchestra, right? The orchestrator, if you want to call it. The conductor at the symphony. You have to be well versed in what you're doing. And I think, just speaking on my personal experience, I think AI can do a lot of that. And we're trying to do that in Nimbus, right? They can help physicians stay on track and manage this orchestra a little bit better. But that's the biggest reason, right? That's why doctors just like, I know what's going to come down with this, and I don't get paid enough to do this.
That's right.
So I am just going to give you sertraline or Zoloft, right? And call it a day. That should take care of your vasomotor symptoms. You won't be bothering me for a while.
Right.
And they don't get paid to do that either, right? No. In a normal primary care practice setting, and I can go on about this and what's happening in primary care. That's a whole different conversation for another day. But these VC companies coming in, and now I have PCP friends who are like, I got to see 30 to 35 patients a day where I don't get paid.
I don't have 20 minutes to sit and listen to all the symptoms that are happening.
Which is what it requires to get to it's like you're investigating, right?
Well, and also, again, if you're just giving everyone the same dose, that's not going to work for everyone. Yes. And so that's where maybe that same dose works for 30% of the people, but that's leaving 70% that are having issues. And, now you're getting phone calls, you're getting emails, you're getting patient portal messages, and you're drowning already in trying to keep your practice alive.
Yes, that is fundamentally what is happening. It's not that physicians don't care. No. It's not that they don't know that this issue is happening, because they do see, the black box warning just got removed, right? But these are the issues I see just from where we're sitting of how long it's going to take to change that.
And also remember, bioidentical compounded are not covered by insurance.
It's not.
So back when I first started doing my wellness practice, I actually got on the phone with a couple of an insurance company. Well, we cover the hormones, but we don't cover the base that it's in. Well, the base that it's in is what allows it to absorb deep into the tissues and deliver it. And so, my answer was, well, what do you want me to do? Sprinkle it on my patients like fairy dust? Yes. And so... Yeah. And so that's the other thing is there's a cost involved if we're doing bioidentical compounded, keeping dosing individualized. And, for a lot of people that makes it not reachable for them. Yeah.